As researchers learn more about coronavirus and COVID-19, the illness, guidelines for staying healthy are changing and they can be confusing. Sometimes the information is directly conflicting other information. Joining us this morning is family physician Dr. Jen Caudle, who can walk us through how we can try to make sure that we're doing all we can to stay healthy now and also in the future. Jen, good morning. Thanks for joining us.
Thanks so much.
So the main issue that we're talking about right now is wearing these masks. And I spoke on it earlier, just as a mom and someone trying to stay safe. I find it really maddening about why we can't get the message out correctly about if you can get your hands on a mask, whether you should wear them in public or not.
Yeah, I mean, you really bring up a really great point. And, you know, this is something that we're seeing with COVID-19 is that as we get more information about the virus and as things change in our country and the world, we're also finding that guidelines and recommendations are changing as well. I know it can be confusing. It can be maddening because it's like, well, wait, what are we supposed to do? The thing with the mask, as you mentioned, is that, now the CDC is considering or rather discussing the concept of possibly recommending that all people wear masks, not just those who are sick, not just those who are caretakers and obviously healthcare workers, which has traditionally been done in the past. So that's the question that's up for, conversation and discussion by the CDC. I agree with you. It is very confusing, but, we sort of just have to wait to see what their recommendations at this point will be.
But Jen, since this is so new, I mean, this is the main issue with this strain of the coronavirus, right? It's new. There's no immunization against it. We're really figuring it out as we go. So correct me if I'm wrong, but just having another layer of protection over our mouth and nose, if we do have to venture out, why wouldn't that be a positive thing?
Well, it's not necessarily not a positive thing, and I think that's one of the reasons why the CDC is looking at this. One of the reasons apparently that we're kind of taking a look at this more now is that we certainly have more widespread disease than we did, say, a few months ago. And there's this concept of asymptomatic carriers or asymptomatic transmission. We're thinking that there are a lot of people out there that have coronavirus and don't necessarily know that they have it and are possibly spreading it, even though they don't have symptoms yet. And the idea behind the masks and reconsidering whether they should be used for all people or certainly more people is this idea of reducing asymptomatic spread. Again, with the mask that we're talking about, it'd be the idea of preventing a person who's ill from getting those particles and those respiratory droplets on someone else. Of course, that's how coronavirus is primarily spread. Now, of course, we don't want to take away masks from healthcare providers. We know we have a huge shortage. That is something that, that's being talked about. And I don't believe the CDC would consider the types of masks that healthcare workers need to be using as ones they would recommend for the public. But you're right. There are a lot of people who are already wearing masks out in public. If you happen to go to the grocery store or pick up a prescription, you're seeing people with bandanas or things like that. So, it's definitely something that we'll have to wait and see if it becomes a formal recommendation by the CDC, but certainly we are seeing people do that already.
And I know a big part of that is there's just a shortage. I mean, look, you can't even find a mask these days, and there's also a shortage for those who are really on the front lines. So I do get that point. Let's talk about some other just protective measures in the seconds that we have together. We've talked about washing the hands and all of that. Now there's new information that maybe this droplet could spread like 27 feet. So what else should we be doing? What that we can control right now, Jen?
Right. Okay. So the social distancing is definitely one of the best things we can do. Social distancing, staying 6 feet away from other people, not going in crowds, in groups, really staying away from others, staying at home. We have to take this seriously. We all have to participate. You did mention washing hands. We cannot stress this enough. Washing our hands for 20 seconds at least with soap and water. If you don't have that, using hand sanitizer with at least 60% alcohol content. But of course, disinfecting surfaces at our home and sort of making sure that we're coughing or sneezing into our elbow. Things like that are things we can do. But enough cannot be said for washing our hands and social distancing. And of course, not touching our face. That's important as well.
Dr. Jen Caudle, family physician, it's been a pleasure to talk with you. Stay safe and thanks for spending some of your Wednesday morning with us.
Thank you.